Hi everyone, it's Dr. Kim. 10 fun facts that you may not know about botulinum toxins. Number 1, there are actually 4 approved botulinum toxins on the market in Canada, but we usually talk about Botox. Botox is a brand name and it has that brand name recognition because it was the first drug on the market and therefore people recognize the name. The other 3 drugs are Dysport, Xeomin, and Nuceiva, also sometimes known as Nutox. And there's a whole bunch more coming down the line. There's a ton of them in research and development. And in fact, in other parts of the world, there are other drugs that are approved that aren't approved here in Canada yet. Number 2, Botox was actually developed for a medical reason, for Blepharospasm, those annoying little eyelid twitches you get. Some people have that continuously. Botox was developed for ophthalmology to break those muscle spasms. A super smart couple out in Vancouver, Canada, the Carruthers, a ophthalmologist, dermatologist, husband and wife team, realized that their Blepharospasm patients were looking really good and were actually asking for the drugs to be used in other parts of their face. And that is how Botox went from a medical treatment to a cosmetic treatment. Number 3, although we now think of Botox and Dysport and Xeomin as having cosmetic uses, they actually have a lot of medical uses too. Not just Blepharospasm, but masseters, sweating, migraines, kids with cerebral palsy that have muscle spasm. All of those are medical uses of Botox, not just cosmetic. Number 4, so the second drug on the market is Dysport. Some people call it Dysport. Dysport was actually first developed for medical reasons. Dys coming from dystonia or muscle spasm, and Port from Portsmouth, England, where it was first approved for this use. So Dysport, dystonia, Portsmouth, England, first approved for medical reasons and then approved for cosmetic reasons. Number 5, some of the most rapidly increasing uses in our botulinum toxins are actually medical. Because of the pandemic, a lot of people have been suffering from teeth grinding, stress grinding of their teeth at nighttime. And we've seen a rapid increase in the use of botulinum toxins in masseters. Here, the big muscle on your jaw. You clench that at nighttime and grind your teeth. It can also lead to headaches. So that is one of the most rapidly rising uses of our botulinum toxins here. Masseters for teeth grinding and headaches, and also helps slim the face. Number 6, another rapid increase in Botox and botulinum toxin uses is related to Zoom during the pandemic. And we are seeing a rapid increase in the request for Botox in the neck for necklace lines, the platysma bands, which are the vertical bands in the neck, as well as what we call the Nefertiti lift, which helps smooth out the jawline and lift up the cheeks. This demand is all rising from Zoom and people looking at their necks and jawline on camera. Number 7, another rapidly rising request that we are getting is for preventative Botox or baby Botox. This is using very low doses of tox, specifically in the forehead and between the eyes, in younger and younger people in order to prevent the development of wrinkles later on. We start with very low doses because a youthful face has expression. We do not want to completely block the expression, simply weaken the muscles enough to help slow down and prevent the development of those wrinkles in the forehead and between the eyebrows. So we are seeing a younger and younger crowd coming in and requesting their tox injection. Number 8, wrinkles at rest, what we call static wrinkles, will not go away completely the first time you use Botox. Botox freezes muscles and therefore relaxes the depth of lines with movement. But if you have deep lines at rest, They will not go completely away with your first treatment. It needs repeated treatments, and also we may need to add other treatment modalities like filler or laser in order to achieve the goal that you are looking for. So one treatment of Botox isn't going to erase all 50 years of lines off your face. Number 9, there are so many areas of research in dermatology and plastic surgery using our botulinum toxins, and they've been shown to treat other areas cosmetically, not just wrinkles. Some things they've been shown to treat: rosacea by shutting down all those little tiny blood vessels, acne by decreasing oil production at the follicles themselves, sweating by closing down overactive sweat glands, whether that's armpits or hair, scalp, anywhere on your body where the sweating is overactive. Masseters, as I mentioned before, for chewing, and hypertrophic and keloid scarring, thick scarring, by shutting down the contraction and the migration of the myofibroblasts, which contribute to scar formation. Number 10, all of these drugs, Dysport, Botox, Nucivia, and Xeomin, all come in a powdered form. And then when we're ready to inject them, we put normal saline in order to mix them up into a solution for injecting. We can adjust the amount of normal saline that's injected in to change the dilution of these drugs and the concentration of these drugs. And the more dilute they are, the more they can travel through the skin. So we can use very small amounts of very dilute tox, what we call microtox, into the skin to smooth out very superficial imperfections, or we can use a much more concentrated amount to go deeply down into muscles and exactly pinpoint the muscles that we want to affect. So there it is, 10 fun facts about the botulinum toxins, Botox, Dysport, Xeomin, and Nucivia. If you have any questions, as always, make sure you post them and I will answer you.